Hello, everyone, and welcome back to another episode of 5 Minutes in GI. Today's focus is going to be on cannabinoid hyperemesis syndrome. So I thought it would be great if we could kind of start off with talking a little bit about the cannabis use patterns and how it can affect GI health.
So that's a great question, Alyssa. And as you all know, cannabis is actually being legalized in multiple states in the US. And I'm sure as we speak, most states are being legalized. And currently, the data is that almost 38 states in the US have legalized cannabis. For medical use. And there are really many states, almost half the states in the US, that have actually legalized cannabis for recreational use. And if you look at the data from 2002, over the past decade, the prevalence of use has significantly increased, and not just in young people, actually, it's across all age groups and across both males and females. And really, to put it in perspective, if we look at some recent data, more than 52 million people in the US, that's almost about 19% of the US population, used cannabis at least once in 2021. Another problem, I think, is how we perceive cannabis and public perception of cannabis. Now, people thought that cannabis was risky about 20 years ago, but again, that percentage has dropped significantly, and so most people actually think or perceive cannabis to be beneficial, and so I think that creates somewhat of a conundrum. Your second question about effects on GI health, again, is a great question. A lot of people use cannabis for multiple reasons. So they use it for stress, they use it for nausea, they use it for sleep. Many people use it for pain, but now we're talking about GI health and vomiting. And so I think in the context of vomiting disorders, some of the things we need to know is, yes, cannabis is an antiemetic, and there are synthetic cannabinoids like nabilone that are actually FDA approved for chemotherapy-induced nausea and vomiting. But the paradox that we're going to actually talk about today is that cannabis, particularly chronic heavy cannabis use and even high potency products, can actually lead to hyperemesis, or what we call cannabinoid hyperemesis syndrome. And so, I think that's very important to understand.
What exactly is the cannabinoid hyperemesis syndrome and how do you diagnose it?
Yeah, great question. I can start by explaining what cannabinoid hyperemesis syndrome is. It's also known as CHS. It's similar to cyclic vomiting syndrome in that, both conditions are characterized by sudden episodes of vomiting that last less than a week. They usually they have to be at least a week apart, with at least 2 in the past 6 months and at least 3 in the past year. And in both syndromes, both cyclic vomiting and cannabinoid hyperemesis syndrome, there's an absence of vomiting in between those episodes. The difference, however, is that cannabinoid hyperemesis syndrome usually presents after prolonged and excessive cannabis use, and usually stops after the recommended 6 to 12 months of stopping marijuana usage. Some patients, it's important to be aware, even though they don't have vomiting between episodes, they still may have nausea and abdominal pain. And it's also important to note that there isn't a blood test necessarily to diagnose this condition. Rather, it's usually a decision your doctor will make based off your history.
Just to kind of piggyback on that, I really want to emphasize here, like, Ben said, that CHS and or CVS is really not diagnosed by blood tests or biochemical markers because there are no tests like that available. And so we really rely on something called the Rome criteria, or clinical criteria that are used. And the Rome criteria are those that are established by experts based on the evidence in the literature. So it's really important actually to recognize that there is a recurrent pattern of vomiting in these patients. And so that should alert the clinician to a diagnosis of CHS.
That's all the time that we have for today. Make sure, if you haven't already, please hit that subscribe button. And as always, if you have a question after watching this video, please feel free to email us at iffgd@iffgd.org. And we'll do our best to answer your question in another episode of 5 Minutes in GI.